Hello, everyone. Happy belated New Year. Hopefully it's not too late to say that. My name is Janik Garayeb, and I'm the Senior Health Education and Engagement Specialist with Brain Tumour Foundation of Canada, and really pleased to be online with you today. Last year we hosted 8 webinars and had close to 800 people register, and almost over 1,300 YouTube views of the various webinars from 2019. This year we decided to challenge ourselves a little more and offer 12 webinars, so one webinar a year, or a month I should say, 12 webinars in the year, and today is our first one with Mary Lou Robertson on how to advocate for yourself in the healthcare system. For those of you who have been in the brain tumor community in Canada for a long time, or for those of you who have been affected by brain tumors more recently, our mission is to reach every Canadian affected by a brain tumor through information, education, support, and research. And one of our main goals is to provide current information on brain tumors for the community. And really, we want to also provide helpful information that will help you make an informed decision about your health as well. Our webinar series is just about one educational program that we offer to those affected by a brain tumor. So please make sure to check out our brand new website at braintumor.ca and check to see all the different ways you can educate yourself and information that you can download for yourself also. And so before we get started, we just have a few logistics. Everyone has been muted automatically so that we don't have background noise during the recording of the webinar. If you are having difficulties hearing us, please make sure your sound is up on your computer. All the webinars are recorded and uploaded to our website within a week or so. And what we'll do is take up questions at the end of the webinar. So if you have any questions, you can type those into the chat menu, and I will read those questions to Mary Lou at the end. So before we get started, I just have a couple of poll questions, just to gain an understanding as to who is online with us today. So if you could take a moment and please select one that best describes who you are today on this webinar. So are you a patient or survivor? Are you a caregiver, family member or friend, a healthcare professional, or a Brain Tumour Foundation of Canada volunteer? And I'll give you a moment to answer that. Okay, looks like most of you have responded. So it looks like, Mary Lou, we currently have about 54% online who are patients and survivors. Excuse me.
Great.
8% who are caregivers, 4% family members or friends, 27% healthcare professionals, and 8% are Brain Tumour Foundation of Canada volunteers. And the second poll question we would like to ask is, how did you hear about the 2020 Brain Tumour Webinar Series? So please select one, once again. Was it through an email communication, social media, a family member or friend, an online search, or were you referred by a healthcare professional? And not surprisingly, we have an overwhelming response of 84% heard about this webinar through our email and e-blast. So thank you to our communications team for always doing such a great job at sharing our educational programs to the community. All right, so I'll get started by introducing Mary Lou Robertson. Mary Lou and I actually met about 12 years ago at the very first Halifax Healthcare Professional Symposium, and she was actually one of our first presenters. So this is a very fitting topic for Mary Lou because she has extensive experience working in the healthcare system. She's a registered social worker with 20 years of experience in health system navigation. She works with a range of stakeholders in the private, public, and nonprofit sectors on initiatives to improve patients' experience in accessing treatments and practical support. Mary Lou has contributed to discussions on national pharmacare, oral oncology drug access, and improved screening on patient and caregiver needs in hospital clinics. Mary Lou is also a member of our Brain Tumour Foundation of Canada Board of Directors and a volunteer of our Advocacy Committee as well. This webinar is going to share essential skills and information needed to be an effective self-advocate because, as you know, our healthcare system is very complex, and it is important to understand how to voice your needs or the needs of your loved one. So today's presentation is entitled How to Advocate for Yourself in the Healthcare System, and Mary Lou, I will pass it off to you.
Thanks, Janique. I really appreciate the invitation to come on and participate today and present to everyone. I'm thrilled at the number of people attending that are patients, people who are experiencing the healthcare system, those who work in the healthcare system, and those who are caring for loved ones. I think you will get something out of today's presentation, and I hope you get my unique spin on some of this. You're going to find it's less textbook and more about the reality of moving through our healthcare system. And I'm going to be pulling both from the academic side of self-advocacy, but also from my own experience and my experience of working with patients for many years. Just one last housekeeping rule. Janique, can you let me know if you can see my screen okay? It should say presenter.
Yeah, we're good to go.
Great, thank you very much. So as she said, I have been a social worker for 20 years. And I actually got into that role not long after I was a caregiver for my mother. I was a caregiver from a young age, from my teens, when my mother developed an early frontal lobe dementia. And since caring for her in my teens and into my 20s, through both home care and nursing home care experience, I ended up caring for a lot of older relatives as well as siblings and other people in my life. I could count up about 15 people that I have cared for, everything from the very deep down and dirty physical stuff of bedside care to advocating for them in the system to working with them on placement and hospital care. So I like to think I have had a variety of experiences, but I've also done a lot of work with caregivers who have found themselves as advocates and patients who are struggling to advocate for themselves to ensure that the things they need are addressed in our current healthcare system. Where I find myself most aligned in this experience has been with people who have brain impairments or injuries. So I've worked in mental health. For a while, my specialty was working with those with chronic mental illnesses like bipolar illness or schizophrenia. And those people were older, so they had also developed a dementia, so they were very complicated. They had very complicated needs. I've also worked with those with chronic mental illness that are fairly well managed, but have needs come up from time to time, and those with brain injuries and those with dementia. I should also mention I've worked for 10 years in cancer care. So much of that time has been spent with the brain tumor community for those with malignant tumors. And I learned a great deal from working with that group of patients. From time to time, I'm going to catch a breath during this presentation today because I'm just coming off a cold. So if you hear me kind of go, it's you'll have to pardon me, but it's just catching my breath as I go along and talk. So these are my disclosures. As Jenny mentioned, I do sit on the Brain Tumor Foundation Board of Directors, which is a fairly recent role for me, which I was pleased to be invited to do, and that follows some work with the Brain Tumor Foundation of Canada Advocacy Committee. And some of you attended my presentation a little while ago at volunteer training. Oh, and get some background noise, Janique.
Yeah, I think we're having some challenges with the audio, but I can hear you okay, and some others are saying they can hear you.
They can hear me?
Yeah.
Okay, great. So I did work with Advocacy Committee for a while and continue to do. And from that, we did a session at the recent volunteer training for BTFC when I talked about system advocacy or advocating on issues. And this presentation came very much from that presentation where people were coming up to me afterwards saying, I'm really happy to advocate on some of the systemic issues that need changes for our community, but I happen to have this personal issue that I need to advocate for myself on, and do you have any advice? And I found myself having so many of those conversations that I said, wow, we really need a session on self-advocacy. So I went to Janique and we started talking, and here we are. So here's what I hope to do today. The first thing we're going to do is we're going to differentiate self-advocacy in healthcare from other forms of advocacy. Because when you talk about advocacy, even if you look at healthcare versus disability care versus the legal side of things, advocacy can take on a different meaning in different settings. But even in healthcare, it can have very different meanings at different levels. So we're going to talk about what self-advocacy means. We're going to outline why self-advocacy is needed. And that's a very important point to me. I don't start any presentation without talking about why we're even here and why we're even talking about it. And there's a particular reason why we need to do self-advocacy in this day and age, and we'll go into that in this presentation. We will outline some essential skills that I hope will help you today, and give examples of how these can be used in different healthcare settings and in different situations. And because care is becoming so personalized, and everything we're learning about diseases and tumors, both malignant and non-malignant, is showing that many conditions are in fact rare and have a unique course of treatment that needs to be taken. And I'm going to talk about how self-advocacy in some situations for rare disease need to be approached a little bit differently, and how. So just a reminder to mute mics. Again, still have you hearing some background noise, but I'll keep going. So first of all, what's advocacy? So a lot of people, when you see symbols put up for advocacy, they have mega horns, or they have people in protest, or people writing letters. This is the one I use. Advocacy to me is about putting together pieces to make a case that leads to an action that makes some change. So it's essentially an action that works to affect change in somehow, but there's a lot of work behind it to put pieces together to make that happen. And of course, like I said, there's different types of advocacy. There's self-advocacy, what we'll talk about today, but there's also case advocacy. That's something I did a lot as a social worker, or you might do as a nurse or physician in making a case for a patient on something that they need, like perhaps a certain level of home care or an expedited treatment plan. Peer or group advocacy is something that happens among a group of like-minded people with a similar experience, usually around a particular issue. And that's much of what I was talking about in my presentation a couple of months ago at the volunteer training, which is about system change. Policy or legal advocacy goes even deeper still, and usually employs some professionals to guide you through the process, where you're trying to get some major policy revisions made or even laws changed. So there's different levels, and today we'll talk about self-advocacy. So I've done a lot of digging around self-advocacy over the years, and there's many different versions of it. If you look to the literature that we see a lot in disability care, particularly overseas in the UK, there's been a lot of work around self-advocacy to describe it as basically a way to speak up for yourself. And that's fine, that's a good definition. If you go then further to cancer care here in North America, there's been a lot of press around advocating for yourself because there's so many gaps in the system, and making sure your needs are heard, making sure you're included in trials and that you're represented, making sure that you're involved in the care plan, and that's good as well. But I've taken a lot of these different approaches because there's still some pieces missing, and I've put together my own definition on self-advocacy. So think of it as a composite. I think of self-advocacy as a purposeful action that helps a person advance their rights, that helps them articulate their needs, that helps them receive needed service, and most importantly to me, to achieve dignity. Dignity in care, dignity in treatment, and dignity in the experience of going through the healthcare system. And it's that dignity piece that's often been missing from a lot of those other definitions. The difference between self-advocacy and the other types of advocacy is this type focuses solely on a person's need or goals. That might be your own needs, or it might be the needs of someone you're caring for. And it focuses heavily on promoting individual rights. So not the rights of a group per se, but your individual rights as it exists at that time and place. So I want to further differentiate and just make sure people understand what self-advocacy is, because again, I think sometimes we get certain images in our minds, particularly in this day and age when people are online. People try to advocate for themselves in social media, and often people can get very emotional and very assertive about what they need, and that's not always quite self-advocacy. So when I talk about self-advocacy, here's some examples. And this is again thinking about healthcare. One example is ensuring your eligibility for a treatment or service is heard. So if you feel you're eligible for a clinical trial, if you feel you're eligible to take a certain type of treatment, even though you might not fit the model of care, talking about that and giving a reason for that and trying to achieve that treatment or service for yourself is a form of self-advocacy. Another one is, that should say, ensuring your voice and experience is reflected in care decisions. Many times I've witnessed people who are removed from care discussions, and they haven't been asked if they want to be removed. They're just not included. There could be an assumption about how much they understand what's going on or how hard it is on them, but you may feel very strongly you want to be included in that care decision discussion. So ensuring that is a form of self-advocacy. Requesting more appropriate treatment for your needs. Perhaps you have a home care plan that's not meeting the needs that you have. Maybe it's lacking certain forms of rehabilitation or vocational support, or even enough personal care coming in. And you need to make a case to your care coordinator for why you need more. That's self-advocacy. Protecting your right to say yes or no to treatment. There's a lot of pressure in today's healthcare system to align with what treatment is recommended to you, but you may have strong values about what is appropriate for you and your family. And advocating for that right to treatment or to say no to that treatment is another form. And protecting your right to be informed and to be safe in receiving your care. That could be how you're transferred from bed to bed. It could be the amount of information you get before an IV is put in your arm, or it could be, it could even be about how much information you receive from your healthcare record. So those are just some examples. There's many more, but I'm trying to paint a picture for what self-advocacy is all about. Here's what it's not, and this is my opinion. Pushing for preferential or special treatment, like you prefer to have a private room, which might not be possible. And you might, there's a difference between needing a private room for certain physical needs or healthcare needs and simply preferring it. So simply trying to push for a personal preference is not quite self-advocacy. Demanding that rules or protocol be broken to serve personal priorities, putting somebody else on the line, or trying to put other people at risk doesn't cut it either for self-advocacy. And that also includes advancing a cause. Advancing a cause would go to one of those other examples of group or peer advocacy. But when it comes to self-advocacy, usually it focuses on yourself and what you need from that particular situation or action. So that's the difference. And if people have questions about that, we can certainly tap into some of that at the end. So here's my favorite question. Why do we even need to have self-advocacy in the system? Now, I've been a caregiver since I was 18. And if I'm going to be completely honest, that was 30 years ago. So now you know how old I am. But it hasn't changed much in 30 years, unfortunately. We need self-advocacy because our system is still very much confined to a regimented and restrictive type of model where you follow a certain path in a certain order at a certain pace to the needs of an organization or a protocol. So think of it like being in the queue, and you'll see I have some pictures there that will remind you of some of this. You're very much in the queue waiting for direction as to what the next step will be. The difficulty with this is that what we now know of diseases and how they're treated doesn't fit that model anymore. It doesn't fit the queue and boxes and categories. Illnesses are becoming very unique, and the more we learn about them, the more we realize they need personalized treatment. We're also realizing that we're complicated beings. We have blended families. We have contract work versus permanent full-time work. We move around the country. We no longer have static lives that follow a regimented model. So the reason we need self-advocacy is because our needs no longer fit in the system we have in Canada. It's not to fault the system. It's just taking a long time for the system to catch up to this. And there certainly are good stories of certain communities that have made strides in trying to shape healthcare around the needs of their patients, but we have yet to see this on a larger scale. So what holds us back as self-advocates? Because many of us find ourselves in the system where we know we need to say something about what we need. We know that there's a change that's needed, but we don't feel prepared or ready to talk about what that is. And if you were completely ready, you wouldn't be here today in this seminar. I think we all need to learn something about being self-advocates. And in a little while, I'll go into how I was just reminded of that myself 30 years later. What holds us back is that we have a mismatch between how our system looks now and what's being told to us. Because everything in the literature says you should ask questions. Come with a notepad full of paper and have questions ready and ask them. Set goals for your care and talk to your team about what those goals are. Stand up for yourself. Make sure you talk to your doctor about what your unique needs are. Make sure your needs are known. I'm sure you've all seen this in various literature, posters on walls in hospitals, pamphlets that you get. The problem is that the systems we have in place in the hospital don't let that happen. We have busy clinics, doctors that are stressed out and running quickly from patient to patient. We have charts that have little boxes that don't always capture everything about our situations. We don't have time that's given to the assessments that nurses and occupational therapists and physiotherapists and social workers use that allow them to ask all these questions or allow you to participate. So although we're encouraged to participate and advocate for ourselves, the system doesn't allow healthcare professionals the latitude, the time, and the ability to respond to that and truly work as team members. Again, there's many exceptions, but the system as a whole doesn't reflect that just yet. So we're left trying to figure it out. Andre Picard said it well, and he's a columnist for the Globe and Mail that many people know and has written books about these types of topics. And he writes about the healthcare system. And he feels that one of the big problems with Canadian healthcare and our ability to self-advocate is that it's not clear to us who we should go to when we have a problem, who's accountable, who's in charge. So we can talk about what our issue is to the person in front of us, but their ability to create change for us is not always apparent. So next I'm going to go into some of the essential skills. It's not all doom and gloom. I'm going to go into some of the essential skills that you can use to try to make your needs known.
Mary Lou,
yes.
Do you want to do the poll question now?
Yes, so I was just going to ask you.
Okay.
Before we do that, I do have a poll question that I'd like to ask folks, and I'm going to hand it back over to Janique to do that.
Perfect. Here we go. So thinking of your experiences, what do you feel most impacts your ability to self-advocate in our healthcare systems? We're asking everybody online to just choose one. Ability to communicate well with healthcare professionals. So do you feel like you're being heard? Access to information such as health records, treatment options and services, hospital and clinic processes, so like the flow of care, your feelings of power in the healthcare system. So does your voice matter? And your feelings of the support available to you from others. We'll give everybody a second to answer this. And while we're waiting, Mary Lou, just want to say that this information you're sharing with us is absolutely amazing and your expertise. So thank you.
Oh, thank you. What I'm hoping to capture with this poll is, you know, I can have all these opinions about how the system is, and certainly people like Andre Picard and others have written about it. But I'd like to hear from everybody today what their experience is. What is the one thing that you feel makes it difficult for you to self-advocate?
And 34% of the people online today said that ability to communicate well with healthcare professionals is the number one thing on the list. The second thing, 24%, was hospital and clinic processes.
Yeah.
The third option was 21% with your feelings of power in the healthcare system. And the next was access to information, and then your feelings of the support available to you from others.
I find that really, really interesting. Thank you, everybody, because one of the things that gets talked about a lot is that access to information. But when I've seen similar polls to this, it's the first one I've done myself, but when I've seen similar polls, access to information is an issue, but I find it really depends on the group of patients needing that, particularly parents of children in the system who might struggle. And it also depends on where you live. Different communities in different provinces have better EMRs at the moment, or electronic health records, than others. Certainly here in the Maritimes, we're far from it, and we struggle greatly. But these other things, the difficulty communicating, the processes that hold us back, you know, the multitudes of paperwork, or being asked the same questions over and over and over again, and that reflection of power, those don't get talked about as priorities for change in our healthcare system as much. Access to information is sometimes looked like the end-all and be-all. So I just want to leave that piece with you before we move on, because I think one of the things as you're talking about or advocating on broader issues is to keep in mind that these aren't always priorities, and you may have to speak up and point out how some of these things affect you. I'll just speak quickly to the communication piece. There has been a lot of work on that in the States, particularly in cancer care, but in other areas as well, where they've been looking at how well doctors talk to patients about financial needs and practical issues and struggles they're having. And one of the things they're finding is that they're not. And quickly, conversations are shutting down if someone doesn't feel someone is receptive to their story. If someone has the knowledge behind them that they can understand where they're come from. And I do think we're going to see some things come out in years to come in the medical education system about how to improve communication with patients on some of those issues. But we've got a long way to go. So thank you all for contributing to that. And it reaffirms my fact that the way our system's structured does have a lot to do with how readily we feel able to self-advocate. So that leaves us now in a system that may not support us well, but we're still going to have situations where we need to advocate for ourselves in a variety of different situations. So this is a long-standing framework for advocacy that was set up by two women back in the 90s that's still looked at as a core framework for advocacy in many different settings, and much of this has to do with discussions and advocacy around treatment decisions. I'm going to use this, though, as a framework, and I'm going to cheat a little bit, and I'm going to put in some of my own tidbits around each of these to provide a broader framework to help you understand each of these sections. So these two researchers felt there were 4 components to advocacy. One was information seeking, which is asking questions, gathering information, kind of what I say is getting all your ducks in a row. Then there's communication, the part we have difficulty with, talking to your doctor, or talking to your nurse, or talking to your home care coordinator, or whoever that may be, your GP, about what your needs are. Once you get that out, it's then problem solving, figuring out what you're going to do with it. And then negotiating, getting it down to the fine details of how some change is going to take place. So it sounds simple, but there's a few more steps involved in those that I want to go into. The first one is on information seeking. Here would be my tips if I was to create a list to tell you how to go about addressing a problem and standing up for yourself or addressing something that meets a need for you. Here's some of the things I talk about. Under information seeking, it's first of all understanding what your ask or your goal is. We can all be very frustrated with our healthcare experience, and so there may be a multitude of things that we want to see changed for our care. But when it comes to creating change for ourselves, we have to do it one at a time. So we need to first go at it in a very methodical approach and create an ask or a goal that's clear. So an example of that might be, I want to increase the personal care allotment for my spouse to once a week bathing instead of every 2 weeks, because in some provinces that's the reality. That's all you get. Or it could be your goal is, I want to try this clinical trial, even though your initial response was, you told me I wasn't eligible. I want to see if there's other options. So first of all, understand what your ask is. Understand where it comes from. Why has it happened? Why are you at this place? If it's a home care issue, get familiar with the home care policies that are in your province. They're right online most of the time. If not, ask somebody, speak with your doctor if you can, or speak with someone in your support group, see what their experience is. Understand where it comes from usually takes some digging, but it also takes some reflection about why this is not satisfactory for you, why you need a change. Inform yourself on how an outcome will impact your life. I can't stress this enough. Many times patients come to me wanting to advocate for a change for themselves. And sometimes that creates risks. So the best example I have is, I want to take that trip to Mexico because I've been told I only have 2 years. Or I've been told I'm going to, my mobility is going to decline further. And I would like to do it while I'm walking around and able to. What's the risk? If you get sick, what do you have to look at for insurance? You know, what is the risk to your health and what will your caregiver be left dealing with should something happen to you down there? I mean, this is a very simple example, but if you're going to push for a medical approval or a signature on a form to allow you to go there, understand what the outcome will be. The same for if you sign up for you're pushing to get onto a clinical trial that carries a lot of risks, or you're wanting a home care change that's going to mean a lot of more people in and out of your home. The other piece is gathering relevant information as you're able and identifying what else you need. So get all your ducks in a row, get all the information you need from where you can get it. And when you're short on information, try to get help as much as you can. And that could be from people at the Brain Tumour Foundation of Canada who might know some resources you can check. It could be your GP, it could be your local library. Find out that information that you're looking for. When it comes to communicating, after you've formed your ask and you know exactly what it is you want to be advocating for, determine then who you're communicating with. This would be my other thing that I would want to stress strongly. This would be like my #1 thing I'd point out of all of these lists, the #1 thing you should think about, and that's important. Who is it that you're going to talk to about this? And how does your request intersect with their ability and power to make change? We often come in with demands. We say, I really want this to happen. I need this to happen. I want this to happen in my life. I need a change for my health care. But we fail to recognize that the person sitting in front of us or the person on the other end of the phone might have very little power to make any kind of change. So if they can't, then who? They might be the first person you talk to, but maybe the nature of your discussion shifts so that you're not actually asking them for a change. You're seeking advice and you're saying, okay, I realize you can't do much about this, so who should I talk to? Or how should I approach this person? Or where else could I go? When you're communicating and before you have that conversation, create 3 key points. That's a standard advocacy type of lesson, and it speaks to policy advocacy and any advocacy. And it speaks to self-advocacy. Never have more than 3 points. Focus its benefit on you, not a change to the system. Always on you and no more than 3 points. Key lesson. The reason you focus it on you is you can quickly deviate the argument to something that's very weighted, that's something that's going to have a lot of complexity to it. And I'll give you an example. One of the things I've worked on for years is to get equal funding for oral treatments. Those of you with glioblastoma, one would be temozolomide, but there's many others for many other different types of cancers and other treatments, and other diseases, I should say. I'd like to see parity, no matter how you get your treatment, whether you go into a hospital for it, you take it at home, you get funding for it equally. It shouldn't be different just because one you take it home, one don't. When I've seen people go in and make a case saying that my oral drug shouldn't be coming out of my pocket to pay. You as a system should be funding it, because if I'm saving you a chair, I don't have to come into hospital for it. I'm saving you money. Nobody could care about that because the system's not set up that way. The system's not set up to think that way or to actually look at the practicalities of that. The argument completely makes sense, but the benefit to you has been lost. Now you're placing the benefit on the system, and it becomes a much bigger issue. Instead, you're saying, I really think that the funding for me should be more in line with IV treatment because I'm making an expenditure out of pocket that's impacting my ability to look after my other medical needs. So the focus stays on you. When you're communicating, be clear, concise, and consistent. Consistency is key. People can get off on a tangent, go in other directions. I'm one that can talk and talk and talk. Many people say in my family that I'm like Woody on Cheers, that character years ago who always had a relative that had some weird ailment. And I was 30 minutes into a story and they forgot what it was all about. So I'm famous for that. But when I get in a room and it's around self-advocacy, I want to be in and out of there in 5 minutes. And I want to make my case. Be consistent. It works much better. Always bring documentation or web references with you, especially if you're making a case for wanting a treatment. And when possible, refer to previous cases or precedents, or even similar policies. I once helped a patient get much better transportation assistance with the cost of transportation to treatment back and forth, because I pointed out that the way his, the eligibility for his income was being unfairly calculated based on the way they did it for other patients. So I used similar cases to make a point that he was being treated unfairly. So that's information seeking, communicating, and now problem solving. So after you've communicated, the first person's going to come back, that they're going to say, well is almost always the first word out of the mouth. Well, we can't do this because of XYZ, or well, that's going to be really difficult because, you know, we'd have to do this and we'd have to do that. What you need to do at that point is say, I need to know if you're able to help me. And if they say, my hands are tied, I can't do it, then their power will be more prevalent to you and what they can do. If they can't help you, identify who can. I'll give you another example. I was recently trying to find an appropriate discharge facility for my mother-in-law, who recently passed away. And this was because she was in a ward in a hospital, a general ward, with 5 other beds with roaming dementia patients that kept her up all night. She was trying to recover from a surgery and she hadn't slept in 5 days. So we knew she needed another facility. She lives in another country, in England. I didn't even know how the health system worked over there. So I said, okay. I phoned a local hospital and I talked to their discharge planner. I knew enough to ask for somebody in discharge. And I said, here's my scenario. They're not helping me over at the other hospital. Do you know any other place, because she could pay privately. I said, where she could just recuperate, get some more recuperation time, because her local hospital can't provide a good environment. She said, well, we don't do that here. I could have hung up the phone at that point. And I said, okay, who does? And the referral she gave me ended up leading us to a beautiful facility where my mother-in-law spent 2 weeks getting stronger and was eventually able to transition home. It was lovely. But if I hadn't asked her, okay, who can help me? I would have never gotten the name of that place. So always ask. Don't take no at the first go. Keep going and keep investigating. And gather more information as you go along, as you need it. When you're advocating for yourself and you're trying to problem solve a situation, it gets tough. Pull in help if you can, but do it when it gets tough. Too many people run to the media, run to their MLAs, run to people who they think have more power, who really don't all the time, but who may, a little too early. They want to see what work's been done so far. So do that when it gets tough. And then negotiate. In negotiations, sometimes you're going to have to revise what your initial ask was. Or you might need to accept a different role for the person you're asking to work with. Like a doctor saying, look, if I'm going to do this for you, you need to come in more to see me, or I need to have you do more blood work, or there needs to be more supervision. You might have to think outside the box a little bit about what some alternatives will be. You also have to be open to policies that might restrict changes from taking place, and that's because they're there to protect the greater good, like spread of infection or other safety. When you do reach an agreement, though, you have to hold people accountable to that commitment. It wasn't unusual for me doing case advocacy for me to go back to somebody 1 year later and say, remember what we talked about? I still have it in writing in an email. We're going to do this. Holding people accountable, but making sure that's in writing. Sometimes doctors, in a moment of compassion, will say things they can't deliver on. And they mean well. Don't hold them accountable to a verbal promise like that. Get it in writing. So I think I'm talking a lot about things, and I'm giving a few examples, but it may feel like things are still a bit up in the air, and we should ground some of this in some actual examples. So I have a few options on the screen here. Janika, I don't know if we want to do another poll to see if...
Well, we don't have a poll set up for this, but maybe everyone who's online could just type in their answers.
Yeah, if there's a particular one you want me to speak to in some of these examples, all of these I have experience with. So I could certainly speak to 2 of these on the list about ways you can self-advocate in these situations.
So for those of you who are, okay, we got some questions or some comments coming in here. Somebody said access to treatment services not typically eligible for. Does anybody else have some other human rights issues at work? Is another one. Give everybody just a second to maybe type in the chat section if there's a particular topic you'd like Mary Lou to focus on.
And then we'll try to work from this list too. I totally get the human rights issues at work, and I can certainly do another one on work. I'm going to try to focus on healthcare on this one.
Sure. That's it for now.
I certainly have done ones on return to work for sure.
Okay. It's a mixed bag, Mary Lou.
Okay.
Yeah.
Okay. So why don't we pick that access to treatment, and then I might go into just 2 more. We'll see what time it is here. Sure. Oh, maybe 1 more. Okay. So access to treatment services not typically eligible for. So the best case I have for this community is people who would like treatment for a non-malignant tumor when the treatment they need is typically designed for those with malignancies. So let's say radiation therapy or something within the hospital setting that's in the cancer unit. So the difficulty with something like that, and if anybody has comments about that, they want to chime in there, go ahead, Janique. The difficulty with that, again, is our system design. So our system design in cancer care is generally designed to see people with a diagnosis of cancer, not a non-malignancy. However, there may be certain situations of either early stage tumors or non-malignant tumors where research has shown that there's benefit from getting treatment with the type of machinery or the type of medication available through those cancer areas. And it's not unheard of for people with non-malignancies to get treatment in those areas. But getting in the door can be tough. This is where it comes down to the information seeking. If you go back to information seeking, the biggest thing you're going to have to do to start is to prove your case about why the treatment is relevant for you. And that's where you would look at outcomes. You would look at what trial literature is available to show it's worked. Or if there's certain aspects that you and your doctor, your specialist, your neurologist, or even your GP you have talked about that could benefit you, like pain reduction, pressure reduction, then make a case for it. Outline it clearly on paper. And that's where you send it in to ask for a consultation on referral and get a cancer treatment team for that area, like the neuro team, to review it. If they refuse to accept it, send it in again. Ask for it to be reviewed and ask for the GP to call and talk to that cancer team. This is, I'm just throwing out an example here, not knowing a particular hospital and their procedures. But this is just an example of what could happen. Once you have your information there and you're communicating with someone, then they may call you directly, or they may give you a letter and outline why you might not be eligible. If they outline why you're not eligible, and it's very clear, you may need to then question that policy about eligibility at a higher level. Could be through a patient representative at the hospital who could then act as a go-between on your case, or it could be the manager of that particular cancer unit, or it could be the head of that particular service, like the head of radiation. Again, that's where you need an ally that you would have to pull in, like a GP, to help make your case, or another specialist. Making a case on your own for a treatment that is not typically given to someone in your situation by yourself has very little chance of success. It can happen, but usually when you're trying to access treatment that you're not typically eligible for, you are going to need an ally. When it comes to negotiating or problem solving that, some of what you might need to do is you might need to talk to them about your level of priority. They might not see it as something that you have they may say, we'll do this, but we can't do it now, or you'll have to wait. And that's where you're going to have to make a case of risk to you. If you're having extreme pain, for instance, and you can't work at your job anymore, make that known. Tell them why the level of urgency for you, if there is one. I hope that sort of starts to get to it, and I can go into that in a bit more detail. I'm just conscious of time, but that's an example of starting to approach something like that. I'll give a slightly lighter, I'm not going to go into appealing an insurance decision. I was going to do that, but I could at the end. I have very specific things on that one. I'm going to go into more dignified care, because that's a quick one, and again would go to a recent situation I had with a relative who had post-surgery been lying in a hospital bed for several days with sponge baths, but no hair wash or shower. This particular person was a woman, took a lot of pride in her appearance, and was feeling very, very low about her ability to have a decent feeling around her hair. Her hair felt very, very dirty, and it was. She looked terrible. It had been a neurosurgery, so there was a wound. But my understanding is that nobody had actually, from the nursing station, gone to the specialist and said, could we do something with her hair at this point? Could she have a shower? Has she been cleared for that, based on where her wound is? That was my suspicion, so I went to them and they said, oh no, she's not eligible for a shower. She can't have a shower yet. And I said, okay, have you actually talked? And I clarified, that's the information seeking. I clarified, I said, have you actually talked to the consultant? And that person said no. So I said, could you please speak to the specialist, which is called a consultant. This was in England. So could you please speak with the consultant and see if a shower is possible? Well, I don't know if we'll have time, she said. We're awfully busy. That's where empathy and the communication came in. And I tried to engage with her and I said, I get you. We've had cuts over here in Canada as well. I know how strapped you are. And I brought out the value of dignity for this woman. And I told her why it was important for her. Long story short, in the interest of time, by the end of the day, she had her shower. And we saw a complete turnaround in her mental health that day. So it is possible. It's about a stepwise approach around the information seeking, communication, getting all your ducks in a row, and negotiating. It takes a bit of a slightly different spin for rare disease. It makes it's a more difficult case if you have a rare diagnosis. And I'm only going to highlight these. I could easily do another whole session on rare disease, but I wanted to touch base on it just briefly. With rare disease, you're often going to have the person you're communicating with is going to be unfamiliar with your situation. So you're going to end up having to keep a summary of not a whole file, not a thick file, not your whole history, but a summary of the key points about your disease and the protocols that need to be followed with it. If you're looking for treatment with a particular drug or procedure, look to see if it's already in the process of approval. If they're saying you're not eligible for that drug, we don't cover it yet, go to the BTFC, who can share with you some resources on where to check if you don't know already, and go to those websites and see, wait a sec, I think that drug's already in the process of being approved. Maybe I could advocate further for an exception for my situation and highlight why you would need it in your situation. To do that, you're going to need to pull data and pull information from those websites about why you would need that, and investigate if it's available in other areas. When doing this and making a case for something that you need for a rare disease, it's going to be important to highlight the impact to you, not the system, but to you, and to also highlight and address what the risk will be to the system, because the people that authorize funding to allow you to have a treatment or a service for a rare disease are always worried that it's going to open up a can of worms and everybody else is going to need it too, because these things are usually expensive. So you're going to address it in a very succinct way to say, no, this is why I need it, and it has little impact for others coming out to ask for it as well. If it's going to have a bigger impact, that's group advocacy. That's a bigger thing. So I'll just share this example. This isn't necessarily a rare disease, but it was a great case. It had easily been one. This gentleman had a blood cancer and needed CAR T therapy, which was not available in our little bitty maritime provinces. However, it was available in the States. And despite the fact that it was in the process of starting to be approved for funding in Canada, the province told him no, they would not send him down to Boston to get it. They would not pay for it, even though in our legislation it does state if it's not available here and it is something that is an approved treatment, we'll send you away to get it. He continued that fight as well as his daughters did. They did not pull in media and allies until they really needed it. But when they did, the province covered it. And now others are getting it as well. His, if you want to look it up in the news, was a great example of self-advocacy. We're almost near the end, so I'm going to wrap up with a couple of things to add to that list I gave about the information seeking, the communication, etc. These are my tips and my don'ts of what to do in self-advocacy. Here are my key tips from 30 years of practice, or 20 years of practice. Engage with the person you're speaking with. The worst thing you can do in self-advocacy is to not go where that other person is. Understand what their power is, understand what their perspective is. Even if you disagree with them, even if they're making you mad, try to engage with them. Understand that they're stressed, they're busy, etc. Don't try to be the expert in everything. There's a reason that person went to 10 years plus of medical school on the other side of the table, or how many years of nursing school or social work school or whatever. You're all the expert in different ways. Be your expert. Talk about the things that you need and why they're important in your life. Know your body and talk about your body and what the impact is for your body with whatever treatment you're looking for or whatever service you need. Empathize with the restrictions that person may have. Don't let it stop you. If they're saying, well, we're too busy to deal with that, don't let it stop you. Just incorporate it in your approach. Say, I know you're busy. Maybe there's a way we can work this out. Emphasize the values that align with that person's hospital. Remember that thing I talked about with dignity with my mother-in-law, who I was advocating for her shower. Dignity was one of the values that this hospital was, that was a big cornerstone for them. So that's why I talked about dignity in her shower. Be consistent, take it slow, and don't deviate from the purpose. Speeding it up and start getting very desperate with your case and trying to make your case doesn't end up leading to too much success. nor does getting mad about it. When it comes to the end of the discussion, especially if you've reached an agreement on next steps, reiterate what was discussed and try to get it in writing, or at least write it down yourself. But here's the things that will make you sink on this effort every single time. These are the things to avoid, and I know this well from practice and from probably doing them myself a few times. Never say you should, you need to, or you must to somebody else. Most times they don't have the power, and it can be extremely frustrating to be told what to do. Don't state it's my right to get this, or it's my right to have this happen, unless it actually is a right. And the unfortunate thing is in Canada, access to many different forms of healthcare is not an enshrined right in our Constitution. So investigate that first before you ever say it's your right. Don't reveal personal details beyond what's needed, because it can actually start to turn the person off, which sounds awful. We're all very empathetic to a person's story, but then it's sort of, if it starts to go on and on and on, and it goes beyond the need, it goes beyond relevance for what you're advocating for, one starts to question what you're actually after. So it can actually hurt your credibility if you go into personal details too much. Don't use threatening or coercive behavior. I think that's a given, but many people do. I've certainly been threatened myself, and with people advocating for things I could help with, but they were so mad about something, they're so frustrated, which is understanding, they got threatening right off the bat and shut everything down. Flaunting who you know doesn't work as well. People like to think it does, but it actually just makes people scared, and can make them not want to work with you on something. Putting the person's position or license at risk, and that usually involves asking a physician or a nurse to do something that they're actually not allowed to do, like cheat on a prescription or sign you up for a trial that you're actually not eligible for, or prescribe something off-label when it's very inappropriate. Understand what risks there may be to their job. And losing sight of the needs and the rights of the person you're advocating for. So this is a tricky pitfall if you're a caregiver, particularly around the issue of home care. Sometimes it crosses a line between what that person needs or wants and what's realistic for you and your support. And that's where you might have to negotiate and give a little bit. It can be very difficult and easy to lose sight of what you're advocating for if there's multiple emotions and responsibilities and needs involved. So if there's multiple needs involved, divvy them up, advocate for them separately. So just to recap, and then we'll go to some quick questions. Sorry, Janique, we're about 2 minutes in. Self-advocacy is a purposeful action that helps a person advance their rights, articulates their needs, receive service, and achieve dignity. That's what it's about. There's a mismatch between what we're told to do in supporting our care and what the system enables us to do. And essential skills for advocacy can be easily organized and followed if you're looking for a guide into information seeking, communication, problem solving, and negotiation. And in the case of rare diseases, you have to do some additional work, usually ensuring that the benefit to yourself is outlined and the impact to the system is outlined as well. So thank you. That's my email. I will caution everyone, I do not take in my practice any more individual cases. I advise and consult and sort of do things at a education and higher level. My license does not allow me to do clinical work where I'm working with someone one-on-one, so I can't take on cases if you're having any difficulty. I certainly don't mind providing guidance in situations like this or through BTFC. But if you'd like to know a little bit about my work, or you want me to come and speak to a group again, feel free to reach out.
That's great.
I'll put it back over to you.
Sure thing. Thank you so much, Mary Lou. Before I take a couple of questions, do you want me to launch that last poll question?
Sure. Oh, thank you. I forgot about it.
It's okay. So everybody,
you know what? Let's. Well, go ahead if you'd like. Go ahead. Yeah, I'd forgotten about it. My apologies.
No worries. Just as an FYI, right, for you.
Yeah.
So thinking of your experiences, what tools and supports have you used to help you self-advocate? So for those of you who are online, just choose as many in that list that apply to you personally, and I'll give you a second to do that.
The reason I put that in there is because I want people to see that it's not all just with them, that there are resources out there. You can feel very lost trying to advocate for your needs, but there are ways you can pull information in this day and age. So I was curious as to what people did use.
Looks like people are still voting, so let's give them another second. Okay, looks like we're good. So I'm going to just launch this so everybody can see it. So 93%, Mary Lou said self-help, support groups, and peer discussions.
Wow, very good.
Yep, 57% said professionals, health advocates, hospitals, patient reps, family doctor.
Great.
And 25% said clinical trial databases or journal searches. 7% said 211 information services, and 4% said ombudsman.
Okay.
Yeah.
Very good. Love to see the peer support being a help.
Absolutely.
The key with the peer support is making sure that you have the right information. So people are wonderful supports to each other, but everybody's situation is different. So always back it up with the facts that you need about your particular case, looking at a policy, looking at treatment information, etc.
For sure.
Yeah.
Okay, so a couple of questions that came through. The first is a comment/question. In regards to the hospital and clinical process for self-advocacy, this person says that she has found there tends to be patient information being recorded incorrectly. In addition, patients seem to be spending a lot of time having to, follow up in clinical processes, to ensure referrals have been made, so on and so forth. So patients are spending a lot of time, an amount of time, having to double check information on their files, follow up on tasks. So the question is, how can we minimize a patient's time and have information be accurate along with the clinic completing the tasks they have said they would do?
Yeah. Don't start with an easy one, that's for sure. Oh my goodness. And thank you for that, because it's probably the number one thing that drives everybody batty in our system. And it's no different overseas and other places I've gone. Our systems aren't linked well, but as well, we tend to have a system of a need to double check everything, and that's around liability issues. Making sure your family doctor hasn't changed, making sure that your last appointment was at such and such a date. But at the same time, we're not given the mechanisms to call in and record information and be assured that they hit the other side. So that's where some people are hoping the EMR is going to have an effect. But here's my take on it. I always have the information typewritten out, and I take it with me every time, so a person doesn't rely on my verbal report of the information. There can be typos, people can mishear you. So I always make sure it's there. When I've asked for something to be scheduled, I always follow up. I've seen too many people get lost in the system because a fax wasn't received, an email didn't get received. So I always follow up, which is a lot of work that shouldn't be put on the patient or caregiver, but unfortunately it is. I try to have an ally at each clinic. That's where the rapport building and the engaging with people helps. So if you have a particular clerk that you do a lot of work with, sometimes that clerk will give you their direct line, or sometimes they won't, but you can ask for them when you call, or you can check in with them when you go to the clinic. But yes, I think the biggest frustration is the communication between specialists in different offices, not necessarily in the same office. And that's where the follow-up is needed. Always follow up, and making sure that your information is important and is in there and is thorough. Great. I wish I had something better to add there.
Oh, great tips, though. Thank you, Mary Lou. This one should be a quick and easy one. I think you had a couple of acronyms. Somebody said, what is VT of C?
Oh, sorry, Brain Tumour Foundation of Canada.
Oh, yeah, there we go. And then the last one is any strategies for when you only have a specialist appointment every 6 months, so you feel like you need to address like everything at once in the same appointment? Any suggestions for that? I think it kind of relates to some of your answers before, right? Like going prepared with questions, doing your best to even kind of, clarify your needs.
So I want to to address. I just want to give some thought to that before I jump in it, because there's different issues with different specialists in different areas.
Sure thing.
The first question in terms of that information seeking is finding out from the specialist why it has to be every 6 months. If you have that many issues coming up in between that need that much addressing in that a little amount of time, first find out if that is actually the case. Maybe you're going every 6 months because somebody just told you that's the way it goes. And that's the way this, but maybe there is a possibility of having it every 3 months. If that's not feasible for you and that doesn't work for your life, find out from the specialist if there is a possibility of submitting a more urgent request or question in the interim and how that would be done. It's increasingly specialists are open to emails, believe it or not, or they might have another mechanism for you to do that. If you are stuck with the every 6 month appointment and you have a lot of things that need to be addressed, be clear about that at the start, be succinct in what you need addressed, and come prepared to be able to ask those questions succinctly and to record what needs to happen, and ensure that those all get addressed before you leave. I have literally stood in front of the door so the specialist can't leave before I get them all addressed. Without bullying, I just mean that I've actually gotten up and said, oh, I have just one more. But make sure you know what that specialist policy is around that, if they limit the number of questions. But come prepared if you have to work within that person's system, if you've already clarified that there are limitations, they can't see a sooner, they only have a certain amount of time, then come prepared to work within that.
That's great. Thank you so much, Mary Lou. This was
rank your problems in terms of urgency, but I think that's a given.
Yeah, absolutely. Yeah. Absolutely. Yeah. This is great. This is such great information. You know, we've done a lot of webinars through Brain Tumour Foundation of Canada, but on my end as the facilitator, I can kind of look at engagement statistics while the presenter is presenting, and I think that we've probably had the most engagement we've ever had. People like really listening to you attentively on the slides, so this is really great information. We know this is much needed information for our community, so thank you, Mary Lou. We know you have a busy schedule, and we really appreciate you volunteering your time with Brain Tumour Foundation of Canada as well and sharing your expertise. It's much appreciated.
Can I just thank you very much, and can I just add one thing? That I mentioned that there's other forms of advocacy. So there's certainly self-advocacy, and that's still presenting a case for your own need. But on some of these things that people have highlighted, when you start to talk in your support groups and you see a consistent information or a consistent issue between all yourselves, like the specialist appointment issue or like the repetitive information issue, that starts to become a pure advocacy issue. And that's the kind of thing you can bring to BTFC, the Brain Tumour Foundation of Canada, and say, how can we act on this? And I'm a consultant with BTFC, and I can advise from afar about some tips on how to do that. But that's an example of pure change that you could try to have addressed.
That's great.
Some pure advocacy. Yeah.
Thank you. Thank you. Yeah. Thank you. So before we sign off, I just wanted to show everybody my screen. Can you see my screen? Mary Lou? No, you probably can't see the presenter. Just want to make sure can everybody see the Brain Tumour Foundation of Canada screen? Yes, okay, perfect. So this is our new website. Yay, it looks so good. So braintumor.ca, tumor spelled O-U-R in Canada, not O-R like in the States. And just want to point out that our Brain Tumour Walks right here at the top right, when you click on that, registration is now open for all the Brain Tumour Walks going to be happening across the country in the spring and summer months. We really encourage you to sign up, log in, get your teams together, and when you go back to the home page here, when you go to helpful information at the top, when you click that, it takes you to a section of the website where there's ordering information, so our handbooks and storybooks. And just a reminder, we have a brand new handbook for caregivers specifically, available in both French and English and print and electronically. And then here are the webinar series for the year. So our next webinar, oh, there you are, Mary Lou. Our next webinar is going to be with Alex Rodzinka. He is a Brain Tumour Foundation of Canada research studentship recipient from Windsor, Ontario. and he's going to be talking about his experience going through our research program as a recipient, but also the complexities of glioblastoma. So don't forget to register for that. And that's it. Thank you so much again, Mary Lou. Really appreciate it. If any other questions come through, I will let you know, and we can connect you with that person via email, and we'll go from there. So
yeah,
everybody,
no problem at all.
awesome.
Thanks very much for having me.
You're welcome. Thank you. And as soon as I log out of here, for those of you who are online, there's going to be a survey that pops up. Please take 2 minutes to complete this so that we can plan for future webinars and so we can get some feedback on today's webinars. Thank you again, everyone. Have a great day and chat soon, Mary Lou.
Thanks. Bye.